Hello, and today I take up something very different, something that is not really even talked about, and something that is almost not related to our curriculum. Is the importance of having peripheral knowledge. When I talk of peripheral knowledge, what I am talking about, what I refer to, is knowledge, understanding, experience in fields other than your curriculum. If we talk about homeopathy, other than the subjects of homeopathy per se, other than the allied science subjects that we are talking about, I urge young graduates to explore completely unrelated fields of knowledge and take experience of that. The importance of this is when one does synthesis of the case, understanding of the case, this peripheral knowledge helps us to integrate very discrete, very distantly related phenomena happening in the case. And if you look very carefully at our past masters and even our present masters, you will see that all of them would have a very strong experiences in knowledge fields other than that of homeopathy. There is a lot of cross-disciplinary work that these masters have done as children and even as adults. And these experiences, this knowledge helps us to relate to very distant, very unrelated phenomenon that happen in the case, thereby helping us to understand very deep the portrait of the case. Some of the best people, if we look at in the past, if we see Hahnemann himself, he was a linguist, he was a chemist, and a brilliant student in medicine itself. If you look at Bonninghausen, he not only had the background in law, in medicine, and even botany, very unrelated fields. If you look at some of the masters in the present era, if you see George Whittelkas, himself has an engineering background. If you look at Jan Scholten, he has tremendous background into chemistry. If you see Mikhail Yakir, whose classification of the plants is her training in botany. And there will be absolutely many good homeopaths who would have this cross-disciplinary training. So I believe as a part of future curriculum, there should be credit points given for cross-disciplinary work. It helps innovation, it helps entrepreneurship, and on the whole makes you a better clinician. So do not hesitate, especially in your formative years. Grab every opportunity to do completely unrelated works. Explore the field of knowledge. It will only make you a better homeopath.